COVID 19 has forced all of us to examine global health and education, health and economic security. The pandemic highlights threats to health, and these are not experienced equally by all. Since the first case was recorded in China in 2019, COVID 19 rapidly spread across the globe, causing and disrupting many fundamental certainties, many fundamental certainties at the core of people's lives. Its impact covers beyond health sector, communities and human economic social crisis. The health consequences of COVID 19 have been more pronounced in undeserved and vulnerable groups. The economic impact has adversely affected the poor and the marginalized. The disadvantaged for this population. So, the principles of equity and equality must be in favor of the public health. And we can see them as global goals in Sustainable Development Goal 3 of the UN, which seeks to ensure healthy lives and well-being for all. The one SDG which is specifically devoted to health and well-being is Sustainable Development Goal 3. The health SDG is associated with certain targets ensuring maternal health, ensuring well-being of newborns, ending the epidemics like tuberculosis, malaria and other diseases, reducing mortality from non-communicable diseases, and ensuring universal access to healthcare. Since these targets were set in 2015, we as a global community have seen progress. But there are still a number of women dying in the developing and low-income countries. And the death of a woman due to her status or circumstances in low-income countries is 20 times higher than a woman living in a higher income country. Even in Australia, a high-income country, we see critical disparity in the health outcomes in the indigenous women and women from different socioeconomic and ethnic background. This is preventable, but such casualties continue to occur. Why is it so? In contrast to the improvement in maternal mortality, there are other SDGs, and the situation is getting worse. For example, people's quality of life is reduced due to the chronic diseases like heart disease, cancer, and mental ill health, which is rapidly increasing globally. With aging and industrialization, the population is experiencing chronic diseases, and this accounts for disability and deaths. The impact of this condition is not experienced equally across population. Why is it so? The fundamental concerns of equality and equity have been underlined by SDG. Unequal access to health care, poverty, and harmful gender norms leads to critical health scenario. The criteria which determines a woman's status in society and undermines her power to make decisions on her own and others' health. Chronic diseases is prevalent in people living in poverty, have low educational levels, disabilities, or are marginalized. Chronic diseases are highly preventable through food security, healthy and safe spaces to live and work, and access to limited access to unhealthy products and access to healthy products. Globally, COVID-19 has magnified inequalities and compromised the success we would have made towards the development goals and access to health care for many. The pandemic has highlighted that the experience of health is different for different groups. So, to prevent disease and for the well being for all ages, we must understand a community's experience of health and provide the needed support and resources necessary to overcome these factors that undermine the health and work towards enhancing the points that promote well being. Ensuring equity means all people are provided with the support they need depending on their circumstances. The need to support all people for good health, not just those who can afford it. This is simply about everyone, that everyone receives the same quality of resources. Equal distribution of resources is known as equality. However, some people are far from reaching the target of good health. Distributing resources ensures everyone achieves the global SDG goal of health and well being, and this is known as equity. This means the most disadvantaged receive the most, and this will promote well being at all ages. So you can support equality. So you can support equity in health. There are organizations who care for marginalized population through financial volunteer. Steps like donations, volunteering your time, lobbying local representatives, and speaking out against discrimination is equity. Call out the unsafe, unjust, or unfair practices and try to lower the pollution output. In order to promote equity in health, take action to reduce pollution in air, land, or water. A clean environment is must for everyone. To reach SDG 3, each and everyone needs to do your part. To ensure equity, ensure that everyone has support and resources they need to achieve good health. These small steps which we may take may not feel like much, but collectively can make an enormous difference.